Hi, this is Sarah with the City of Dayton's Offsite Clinic for this month's Wellness Moments. This month we are talking about cancer awareness. So an overview of what we're going to be talking about, what really is cancer, cancer in the United States, cancer risk factors, prevention, and screening guidelines. The goal of today's presentation is for you to understand what you can do to decrease your chances of developing cancer. So what is cancer? Each of the cells in our body have specific functions, and they normally divide in a specific way. But when they're worn out and damaged, they typically die and new cells replace them. With cancer in our bodies, these cells grow out of control, and they keep growing and can't stop growing and making new cells. The space for the normal cells starts to run out, and the cells in that area can't function properly. Most of these overgrowths or lumps are called tumors, but not all lumps are cancerous. For leukemia, there aren't any tumors because it's a blood cancer. These cancerous cells can spread to other parts of the body and grow there, and this is called metastasis. In 2018, nearly 2 million new cancer cases were diagnosed in the United States. The most common types of cancer include breast, lung and bronchus, prostate, colon and rectum, and melanoma. From 1991 to 2015, the cancer death rate in the United States fell 26%, despite the diagnosis rates remaining about the same. This decline in death rate can be attributed to increased screening awareness and improvements in treatment. Catching cancer earlier through screening increases your chances of survival. Many people are understandably concerned about getting cancer screenings during the COVID pandemic. However, it is important to know that it is perfectly safe to get screened for cancer and may save your life. Although the cancer death rate in the United States has decreased, the diagnosis rate has pretty much stayed the same. There are some risk factors that you don't have control over: age, your race, genetics, but there are some risk factors that you do have control over, such as alcohol consumption, tobacco use, overweight and obesity, and UV light exposure. Alcohol can increase your chances of getting breast, liver, colon, rectum, esophagus, larynx, mouth, and throat cancer. And all types of alcoholic drinks are linked with these cancers, including red wine, white wine, beer, and liquor. While red wine does have some health benefits due to the antioxidants, if you don't already drink, don't start drinking because of the perceived health benefits. The risks outweigh the benefits, and you can get these antioxidants from other sources. Alcohol can lead to cancer by causing the body to break down a chemical called acetaldehyde that damages the DNA, which the body is unable to repair. When the DNA is damaged, these cells begin to grow out of control and create a tumor. So if you do drink alcohol, women should limit their intake to 1 drink per day and men to 2 drinks per day. While most people think of lung cancer, all forms of tobacco products are known to cause various forms of cancer, including lung, blood, bladder, cervix, colon, and rectum, esophagus, liver, kidney, mouth, and throat, larynx and pancreas cancer, and cancer of the stomach. Tobacco products contain carcinogens, which are chemicals that cause cancer. These chemicals are carried through the blood to other parts of your body where they cause damage to the DNA and tumor growth. There are 13 types of cancer associated with overweight and obesity, which account for 40% of all of the cancer cases in the United States. We think that the way this works is that excess fat growth causes more inflammation and can cause abnormal cell growth, leading to cancer. Fat cells produce large amounts of estrogen. A large amount of estrogen can cause cells to divide more than usual and lead to cancerous tumor growth. Exposure to ultraviolet light can cause damage to skin and lead to skin cancer. Sources of UV light include sunlight, sun lamps, and tanning booths. Skin cancer is the most common form of cancer in the United States, but it's highly preventable with proper sun protection. So what can you do to prevent cancer? Avoid or stop using tobacco. Eat a healthy diet. Be physically active. Protect yourself from the sun. Achieve and maintain a healthy weight. And stay up to date on your recommended vaccinations and regular preventative screening. If you need help, We here at the doc would be glad to help you. Several screenings exist to help prevent breast, cervical, and colon cancer. The screening guidelines that have been set are based on an individual that does not have any additional risk factors. So if you have additional risk factors, you might need to screen more often. Women aged 50 to 74 and at an average risk for breast cancer should get a mammogram every 2 years. Women 40 to 49 should talk to their healthcare provider if they want to start getting screened while discussing the risks and benefits of being screened. Women with an increased risk of breast cancer should discuss with their healthcare provider about screening recommendations. Adults 50 to 75 should get screened for colorectal cancer. Screening tests include stool tests, flexible sigmoidoscopy, colonoscopy, or a virtual colonoscopy. If you are at a higher risk for developing colon cancer, let your healthcare provider know and they may recommend getting screened earlier and more frequently. Women should start getting Pap tests at age 21 and every 3 years until age 29 if results are normal. For women aged 30 to 65, screening every 3 years with Pap smear alone, every 5 years with high-risk HPV testing alone, or every 5 years with HPV testing in combination with the Pap smear. Women older than 65 are not recommended to get tested if prior testing resulted in negative tests. Lung cancer screenings are not recommended for the general population, but if an individual had a 30-pack year smoking history, or current smokers or a smoker that has quit within the past 15 years, or between the ages of 55 and 80, should get screened. Screening should be discontinued once a person has not smoked for 15 years or develops a health problem that limits life expectancy. Men aged 55 to 69 can decide to undergo a prostate-specific antigen testing after speaking with their healthcare provider and discussing the benefits and harms of screening. Men at a higher risk for developing prostate cancer include African American men and men with a family history of prostate cancer. It is not recommended that you should be screened for prostate cancer after the age of 70. There are some cancers where there are no effective screening tests available, or where screening tests have not proved effective in reducing cancer mortality and are therefore not recommended by the USPSTF. Talk to your primary care provider about your health and family medical history and follow your provider's recommendations on what screenings and exams you need and how often you need them. Make an appointment with either your HealthStat clinician here at the doc or your primary care provider if you have any questions or concerns related to cancer. Our hours are below, and if you would like to call and schedule an appointment, please call 866-959-9355. If you have any additional questions, please contact me at sarah.wiseman@healthstatinc.com.